Okay, Joanna, so we're now looking at about 18 months, isn't it, roughly, that you've been with us? So you initially, tell us a little bit of history. You initially came to us for Pilates.
Yes.
Give us a little bit of background.
So I had some lower back problems after being a bit silly at the gym and trying to lift heavy weights. So I've been having the trouble for probably a year, maybe two, when I first joined. Joined for Pilates, really, just to try and get some more mobility in my back and a little bit more sort of core strength. And yeah, I've been doing Pilates ever since, and it's been quite life-changing for me, really. I mean, the difference it's made is incredible, really. Just generally sort of posture-wise, how I was moving, how quickly the pain sort of went away. I would even sort of be in pain, sat down at the desk, it would start to hurt, and I'd have to sort of get up and move around. I'd get sort of weird sort of clicking. At the gym it was bad. I weight wise I couldn't really lift much weight at all, and now I'm nearly back to where I was before, which is great. You always talk about when you talk about sort of physio and all these sorts of things, it's always, you know, progression wise, physical health. So physical health, yes, I've massively improved, but mental health wise, I mean, I think that's been the game changer for me, because the gym was a large part of my life. I mean, health and well-being is a large part of my life. So mental health wise, it's you know, really massively sort of improved that.
Although we did about 18 months worth of the Pilates, you had a little bit of a setback.
Yeah.
About, what are we looking, about 8-9 months in, roughly? Something like that. And then that's when you took a course of physiotherapy with us.
Yeah.
Yeah. So tell us about the physiotherapy. How did you feel from that?
So I came in and had a sort of an assessment, first of all, for my shoulder. It kind of happened after I got back into the gym, after my back started to feel a bit better, and again I think I got a bit overexcited and went a little bit too often and then hurt my shoulder, so it was self-inflicted. But yeah, the assessment was great. I had some sort of pictures taken of my sort of posture, and everything was assessed. It wasn't just my shoulder, all sorts of parts of me were assessed to double check that it wasn't you know, only the shoulder, if it was anything else that was causing any troubles. And then very quickly got seen, and it was consistent, had sort of treatment on it, sort of physical treatment on it, and had plenty of sort of things to take home and do, which I did at the gym and I did at home as well, so it was quite easy for me to incorporate that into my day-to-day life. And then obviously the app that you have as well, so I could keep track of it on the app and sort of make sure I was doing the right sort of things and make sure I was doing the movement correctly.
You were behaving yourself.
Yeah, and that I was behaving myself, yeah.
Had you had physiotherapy before?
Briefly with the NHS, but it wasn't. I mean, I think I had physio for my back. I had all sorts of things for my back, trying to find the best sort of thing for that. But nothing else worked for any of my ailments apart from physio here and Pilates here. Well, I think because I'd tried a lot of things before, I was sort of in a mind that it probably wasn't going to work. You know, once you've had a problem and it's been so persistent and you've sort of gone through so many things and it hasn't worked, you get to the point where you're like, well, you know, I'll give it a go, because you're sort of willing to try whatever. But so yeah, my mind was sort of in that sort of set that, you know, it will probably help a little bit, but it's not going to completely fix me. I mean, with these things, you're never 100% completely fixed. There's always going to be little blips and stuff, but it's, for the most part, both my shoulder and my back is completely, you know, changed. So I will, if I do feel any sort of pain, I'll just go back to doing those physio exercises that I've been shown, and stretches and stuff like that you've shown us in Pilates. And coming to Pilates every week helps me, especially with my back. You know, your advice as well in the sessions, you know, it's always adapted to, you know, if anyone's got any ailments or anything like that, it's always adapted to sort of people's needs. So I mean, I find that really helpful. Very, very positive, happy. We always have a bit of a laugh, don't we? A bit of a joke. Yeah, it's good fun, and you know, after a long day at work, it's so nice to come in and have that sort of positive attitude and sort of get back into the breathing, you know, be a little bit more mindful in yourself and sort of the things you do, and it's a really nice way to sort of unwind.
What is it like in reception?
Brilliant. It's brilliant in reception. I like coming. Sometimes I just come in a little bit early just so I can chat to Dawn or Bobby on the reception. So yeah, it's just so welcoming. You know, it feels like a family here. Really, it's not like you're coming into clinic and you're sat in a chair and you have to be silent. You know, the people at reception are brilliant. They're so friendly, and so is everyone here. Really, it depends what it is. I mean, sometimes there is. Okay, you know, maybe that hurts, and sometimes it's okay, that kind of feels a little bit better once you leave. But sometimes it isn't an immediate relief. It takes time. That's physio, isn't it? It takes time for these things to work. So you know, it's not to be disheartened when you've done one exercise and you're not cured. You know, these things take time. So yeah, not always is there an immediate relief, but you know, the occasional exercise, it's like, oh, okay, that feels nice. That feels like it's helping.
How would you describe your overall experience coming to see us?
I mean, brilliant. I wouldn't still be coming if I didn't think that it was.
Says a lot, doesn't
it? Yeah. It's just a brilliant sort of service. There's so much on offer, and it isn't just the things that I've got while I'm here. I mean, you've got so many other things going on. So, yeah, I would, if anyone is going through any sort of physical pain and feels that they might need physio, or just generally a little bit of support, Pilates, anything like that, I would really recommend that people at least come and have a try with you guys. I mean, I've had it before. I've spoken to a couple of people, whether they're sort of patients on the services that I run, and I've said, you know, I've had some back pain. I'd recommend going here, even if you just go in or give them a call and have a chat. So yeah, I'd let them know that you guys are really friendly when you first call up or first walk in the door, and to be honest, I'd just recommend that people try it first, and you know, that will show that it's a great sort of service that you run. It doesn't really matter necessarily what I say. I think just people need to come and see for themselves.